Most people think heart attacks strike without warning. That one moment you're fine, and the next you're gone. But the truth is, your body almost always sends out distress signals hours, sometimes even days before the real crisis hits. The key to surviving isn't just what happens in the hospital. It is what you do in the minutes before help arrives. Today, I'll walk you through the exact steps that can save your life or the life of someone you love, from recognizing the earliest warning signs to what to do in those critical first minutes of a heart attack. Let's start with this. Most heart attack deaths happen within the first hour. That SS because the heart's blood supply suddenly becomes blocked, usually by a clot forming inside a narrowed artery. Without oxygen, part of the heart muscle begins to die minute by minute. That's why what you do right away, not 20 minutes later, not when the pain becomes unbearable, can make all the difference. Now, heart attack symptoms don't always look the way movies show them. It's not always someone clutching their chest and collapsing. In fact, half of all victims never experience the classic Hollywood signs. The reality is more subtle, especially for older adults and women. You might feel pressure or tightness in the chest, not necessarily pain but heaviness, like someone sitting on your chest, shortness of breath that seems out of proportion to your activity, nausea, cold sweat, or sudden dizziness, pain radiating to the arm, neck, jaw, or upper back, or even extreme fatigue that feels unusual for you. These are the whispers of the heart, and if you listen early, you can stop the worst from happening. Here's something many people don't know. A heart attack can start hours before the main event. Some patients describe feeling off or flu-like the day before. Others wake up with discomfort in the middle of the night, thinking it's indigestion. But by morning, the heart muscle may already be in distress. If you ever feel those symptoms, and especially if they last more than a few minutes, never try to tough it out. Don't drive yourself to the hospital. Don't lie down hoping it'll pass. Call emergency services immediately. Every minute counts. And in modern medicine, early treatment can mean full recovery instead of lifelong damage. But what if you're alone when a heart attack strikes? That's the question that scares most people, and rightly so. So next, I'll explain exactly what to do if you ever find yourself in that terrifying situation, alone, chest tightening, phone in hand, and how to stay alive until help arrives. If you ever suspect you're having a heart attack, your very first move is simple but vital. Call emergency services immediately. Don't wait to see if it passes. Even if you're uncertain, it's always better to be wrong and alive than right and too late. While waiting for help, follow these critical survival steps. 1. Stay calm and sit down. Exertion makes your heart work harder. Sit upright in a comfortable position, preferably with your back supported and knees bent slightly. This reduces the strain on your heart. 2. Chew an aspirin if you're not allergic. Take 1 full-strength 325 mg aspirin and chew it slowly before swallowing. Chewing speeds absorption and helps prevent further clotting, which can limit the damage to your heart muscle. 3. Unlock your door and keep your phone within reach. Emergency teams lose precious minutes breaking in when doors are locked. Make it easy for them to get to you. 4. If prescribed, use nitroglycerin. If you've been given nitroglycerin by your doctor, take it exactly as directed, usually 1 tablet under the tongue. Never take someone else's medication or combine it with erectile dysfunction drugs, as this can dangerously drop your blood pressure. 5. Breathe slowly and steadily. Panic increases heart rate and oxygen demand. Focus on calm, deep breaths. Picture inhaling through your nose and exhaling slowly through your mouth. 6. Never drive yourself to the hospital. Statistics show that many patients collapse behind the wheel, endangering themselves and others. Always wait for emergency responders. Now, let's address the question I hear most often. Should I cough repeatedly to restart my heart? This is a dangerous myth. Cough CPR is not effective for sudden cardiac arrest and can worsen your condition. The only proven life-saving action is immediate medical care, and if you lose consciousness, CPR from another person. If you are alone and feel your vision fading or chest pain intensifying, stay on the phone with emergency dispatchers. They can guide you in real time until paramedics arrive. Once you've taken these steps, your goal is simple: buy time until professionals can take over. Modern emergency teams carry clot-busting drugs, oxygen, and portable defibrillators. Every second you stay calm, every breath you control, increases your odds of survival. When the ambulance arrives, the most important thing is that you let the professionals take control. They'll immediately attach electrodes to monitor your heart's rhythm, measure your oxygen levels, and start an IV line for emergency medication. In most cases, the first test done in the hospital is an ECG, electrocardiogram. It tells doctors which part of your heart is affected and how severe the blockage might be. At the same time, a blood test checks for specific enzymes, troponins, that rise when heart muscle cells are damaged. Within minutes, the emergency team will know whether you are having a full-blown heart attack, known medically as a myocardial infarction, or a less severe cardiac event like unstable angina. If a major artery is blocked, doctors act fast. You may be rushed to a cardiac catheterization lab, where a thin tube is guided through your artery, often from the wrist or groin, directly to your heart. Through this tube, they inject dye that makes your arteries visible on X-ray, showing exactly where the blockage lies. If needed, they'll perform a procedure called angioplasty. A small balloon is inflated to push the blockage aside and reopen blood flow. Sometimes a tiny metal mesh tube called a stent is placed to keep the artery open permanently. This one procedure, performed within the first few hours, can prevent massive damage and save most of your heart muscle. In other cases, if blockages are widespread or severe, your doctor might discuss bypass surgery, rerouting blood flow around clogged arteries using healthy blood vessels from elsewhere in your body. While this sounds frightening, it's one of the most successful and common surgeries worldwide, with millions of people living full, active lives afterward. The first 24 hours after a heart attack are the most critical. Your medical team will closely monitor you for arrhythmias or irregular heartbeats, which can sometimes occur after heart tissue is damaged. They'll also manage pain, control blood pressure, and begin medications that protect your heart from further stress, such as beta blockers, statins, and ACE inhibitors. During this time, you may feel exhausted, emotional, or even in disbelief. That's normal. Your body and mind have just been through a trauma. But remember, every heartbeat you feel now is one that might not have been there had you not acted quickly. By the end of the first day, most patients start to stabilize. The heart begins to heal, and your doctors will shift focus from emergency treatment to recovery and long-term prevention. Once the immediate danger has passed, the focus turns toward healing, both physically and emotionally. This stage is called cardiac rehabilitation, and it's one of the most important parts of recovery. It's not just about medications or diet. It's about rebuilding your strength, confidence, and daily habits so your heart stays strong for decades to come. In the first few weeks after leaving the hospital, your doctor will encourage gentle, gradual movement. It may begin with short walks around your home, slowly increasing your distance each day. The goal is to restore blood circulation without overworking your heart. Never rush this stage. Recovery is a process, not a race. You'll also be prescribed medications that help your heart heal and prevent another attack. Common ones include beta blockers to reduce strain on your heart, ACE inhibitors or ARBs to control blood pressure, statins to lower cholesterol and stabilize artery walls, and often a low-dose daily aspirin to prevent future clots. Take them exactly as directed, even if you feel fine. Stopping early can undo your progress. Next comes lifestyle repair, the real foundation of prevention. Here's what decades of heart research have proven beyond doubt. 1. Nutrition matters more than you think. A diet rich in colorful fruits, vegetables, whole grains, nuts, and oily fish can dramatically lower inflammation and cholesterol. Limit red meat, processed foods, and sugar-sweetened drinks. Think of every meal as medicine. Each bite is either healing you or harming you. 2. Move every day, but listen to your body. You don't need a gym or intense exercise. Simple daily movement, walking, light stretching, gentle yoga, or gardening keeps your blood vessels flexible and your heart resilient. 3. Manage stress. Chronic stress releases hormones that tighten arteries and raise blood pressure. Meditation, prayer, deep breathing, or even a quiet morning walk can lower your stress levels more effectively than you might imagine. 4. Quit smoking completely. Even a few cigarettes a day double your risk of another heart attack. Your heart begins healing the day you stop. Within a year, your risk drops dramatically. 5. Sleep well and stay connected. Many survivors underestimate the power of rest and relationships. Loneliness, poor sleep, and depression can silently weaken your heart over time. Surround yourself with loved ones, join a support group, and let others walk with you on this journey. It is important to understand, surviving a heart attack isn't at the end of your story. It is the beginning of a second chance. Many of my patients tell me that moment changed how they view life. They started eating better, walking daily, enjoying the little things, and often they feel better in their 60s than they did in their 40s. So if you take just one lesson from this entire message, let it be this: listen to your heart. It speaks long before it screams. The warning signs are there: the fatigue, the pressure, the discomfort that feels different. Never ignore them. React early. Call for help. Take the aspirin. Stay calm. Because every minute matters. And your quick action could be the reason you live to see tomorrow.